My special guest today, we'll get back to get on to our main subject here, is the relationship between teeth and disease. And our guest today is Dr. George Meinig. Dr. Meinig, are you with me here?
I am with you. Hello.
Excellent, excellent. Let me give a brief introduction to Dr. Meinig. For years he was the dentist for 20th Century Fox. He's a founding member of the Root Canal Association in 1943, one of the 19 founding members. He is now dead set against root canals. If we could bring up a picture of Dr. Meinig. He's dead set against root canals, has written a book called Root Canal Coverup. And just briefly, how I met Dr. Meinig, I've done independent research into this subject and was trying to get and totally unrelated to his work, although except on the historical level, and was trying to get, I've studied the work of Edward C. Rosenow. Here we have a slight exhibit on Dr. Rosenow here, if we can go to camera 2 for a moment. Dr. Rosenow was with the Mayo Clinic for 30 years, and he basically showed how various infections from the teeth are causing various diseases, and it convinced me to get rid of my own root canal compromised teeth. So that I was trying to get my teeth taken care of at USC, and the dentist there at USC who explained to me in an email rather, that they could not, this was not a level of service they provided, but he took a copy of my email which laid out the reasons why I wanted the tooth out, and that eventually got over to Dr. Meinig. And I got a call from a gentleman, and we finally figured out that he had called me because he had this email and he was interested, or a fact, he got it by fax, was interested in the subject matter. And I'm just mentioning this as a testimony to the inquisitiveness and the intellectual integrity of this gentleman who is our guest. A true hero in the real sense of the word. He's going right up against all of his former colleagues who are still madly moving along doing these procedures, and he is speaking out on this. Dr. Meinig, please, your floor.
Yes.
Dr. Meinig, could you correct me on any of the things that I've said? Or
no, you said everything just the way it is.
Okay, sir, and could you just explain to the people when you first became aware of the problem with root canals?
Well, I didn't become aware of it until January of 1993. This whole subject we're talking about is commonly called focal infection. A focal infection is one in which the bacteria that are involved travel through the bloodstream and can travel to another gland, organ, or tissue and set up a whole new infection. What was found out by research done in the early 1900s, and particularly a good amount of it during World War I days, was the fact that these infections, focal infections, surprisingly enough, 95% of them came from teeth and infections in the oral cavity. That is, in the jaw bones and the tonsils and the various tissues that represent the mouth. And so what has happened in this period of time, because during World War I days, dentistry was not practiced as well as it is today. If you ask anybody how it was then, they will say it was pretty much the same. But actually, dentistry during World War I days was vastly different than today. The dental office, they had kind of a straight chair. They had none of the reclining tip-back chairs that are so common today. The lighting was poor. The equipment that the dentists used in that time were slow engines that were noisy, and they ran drills that were powered by or cut by steel, and these steel drills have now been replaced by carbide steel. Well, the steel ones got dull very quickly, and so it became necessary for the dentist to keep changing those drills frequently as time went on. What's happened with all of this is that the people who were doing these things kept saying to the patients that there was not much they could do, and people were complaining because the dentistry that was being done was quite painful.
Well, Dr. Meinig, let me interrupt you for just a second, because we know we've made advances, but if we can emphasize the question here of on the root canals themselves, because it's my understanding that regardless, we still do not have a way, once that tooth is no longer vital, once it's dead, there's no way to bring it back. So while we have made some advances, it's my understanding that we still do not know how to cure these teeth. And it's first of all, on the question of root canals, the tooth is basically dead. And then if you could comment on that. I'm not aware of anything, and we've talked about this before. Different fillings have come up. Different things have been tried through the years to fill the canal of the tooth once you take the nerve out. But to my knowledge, nothing has really worked. What's the latest on this?
What would help for people to know is for me to take them into freshman year of dental school and tell them a little about the anatomy of a tooth. Everybody knows that a tooth outer covering is enamel. That's not a very thick layer. It's a rather small layer of enamel that covers all of the crown of the tooth. The root of the tooth is covered by another calcium product called cementum, and it's quite thin and covers the entire root. All of the rest of the tooth, 85 or more % of it, is composed of dentin. Now, the surprising thing about dentin is that it is composed of very tiny, tiny tubules. These are so small you can only see them with a microscope. Now, these tubules in the normal life of a healthy tooth, carry a fluid, and that fluid carries nutriments. Now, the inside of the center of the tooth has a root canal. Now, everybody knows that root canal has a nerve, but a lot of people don't know it has an artery and a vein and other tissue as well. What happens is that the artery coming into that tooth supplies the nutriments to each of those dentin tubules because they open up onto the root canal. And during the course of the day and night, the fluid movement in the tubules goes to all parts of the teeth. And it's the nutriments in those tubules that keep teeth alive and healthy. Now, the nutriments are coming from that artery coming into the tooth and dropping off the nutriments 24 hours a day, the same as arteries drop off nutriments to every cell of the body. The interesting part about all of this is everything is fine as long as the tooth is a healthy tooth. But once the tooth has a cavity in it, and the cavity is allowed to get deeper than it should, then those bacteria that help cause the decay get into those dentin tubules. And when they do, they find that's an excellent place to live. And so they set up housekeeping there, and they multiply by the billions and are present by the billions inside of all of those dentin tubules. Now, Dr. Price, who did a lot of this research, found by studying 100 different medicaments that are commonly used to kill the bacteria in a root canal when the dentist does a root canal treatment, he found that not a single one of those was able to penetrate those tubules more than a tiny fraction of an inch. So in other words, there was no way to kill those bacteria that have used the tooth for their living purposes.
Okay, and then, of course, at some point they invade the center of the tooth, which is called the root canal, and invade the nerve, and then the tooth becomes aching. I can't help but feeling that the response that we have is that once we have that pain in the center of the tooth, the reaction is to take the nerve out so we don't feel the pain, but the tooth is still infected. Cleaning out the central canal does not remove the infection from the tooth. So that being the case, and I think from our previous discussion, you agree with that assessment. I'll turn it back over to you in a second. But I would like to also consider the next question being, if that's the case, then at what stage have we actually lost the tooth? It's very common now in some of the more progressive dentists are realizing that a root canal tooth is a dead tooth that has to come out. But we have to back up on that because it doesn't happen overnight. The tooth has been infected for a long time before it ever goes to the status of being a tooth is on which is performed a root canal. So the question then becomes, at what stage is that tooth lost? Is it lost when we get a cavity? Is there any way to stop that infection and reverse it? Please.
As soon as the use of today of electron microscopes will show the beginning of tooth decay in the enamel of the tooth, and even before the tooth decay gets through the enamel and into the dentin, it has been found that the bacteria that are involved in causing the tooth decay get into those dentin tubules. And so this becomes a big problem as to how soon does this become a death warrant as far as the tooth is concerned. Most dentistry can solve, or we think can solve this problem, because when the dentist removes the decay, he removes a little of the good tooth, and then he puts in his filling material, and supposedly that stops the process. Well, there still should be a lot of research done on this whole subject, because we're not exactly sure as to when it becomes a factor with no end result. We do know that once the root canal itself becomes invaded with the decay, it becomes infected from the decay, from the bacteria in the decay. And of course, when this happens, of course, those dentin tubules are all infected as well. And so, like Shaq said, these bacteria can get back into the root canal from the dentin tubules. So you have two sources for the infection in the tooth. One is the cavity getting into the root canal itself, and the other one is from the bacteria in those dentin tubules.
I wanted to mention this situation. Knowledge of the situation goes back several thousand years. Actually, we can go back to the 7th century BC in Assyria here. There were some actual tablets that were written. If we can go to camera 2 for a moment here. The tablets of Ashurbanipal. Tighten up, please. Tablets of Ashurbanipal in the 7th century BC. He wanted to know what was, he was complaining to his doctor about, please fix up my aches and pains, and the doctor said, you've got to get rid of these infected teeth. That's the only way that you're going to get rid of what basically it was arthritis. So this knowledge goes way back. If we can widen out just a little bit, we can see Hippocrates discussed this same situation here. In the 4th to 5th century BC. Benjamin Rush was a signer of the Declaration of Independence. This is what he made his reputation on. He became the best doctor, the best known doctor of his time in the late 18th century by curing a bunch of a number of arthritics that could not walk. He got them to be able to walk by pulling over the objection of his fellow doctors by pulling their infected teeth. There was also Austin Flint in the late 19th century, but who was also president of the AMA at that time, but the big impetus came when William Hunter in England wrote about this in the early 20th century, and was late 19th century and early 20th century. And then it was the ball was picked up by Frank Billings, Billings Hospital in Chicago. He was the president of the AMA in 1901, 1902, worked on this problem for many years, wrote a book called Focal Infection, worked with Charles Mayo of the Mayo, who then founded the Mayo Foundation, and with Edward Rosenow, who I've studied. So this problem goes way back. Now if we stay right here on this exhibit here, we can trace the problem all the way back to what is known as the legend of the tooth worm. Back 5,000 to 7,000 years ago, the idea was that if you get an infected tooth, a toothache, if you get rid of the tooth worm, you can keep the tooth. And we find the tooth worm in all different kinds of legend, in all different kinds of cultures. The Cuchi Indians in Guatemala. Shakespeare wrote about the tooth worm in What Much Ado About Nothing. We have a picture here of Bisoto the Fasting, which is the toothache demon of the Bosnian gypsies. So it's not, on one hand, we tend to wonder if the dentists today are doing something wrong. They've inherited a long tradition of treating of the tooth as something that is not a living tissue. And so the real important thing that is being emphasized here is that we have to treat the tooth as being alive. And there's not that, and the question is, what can you do to the live tissue of the tooth that you, what can you do that you cannot do to the live tissue of your finger? And this is a problem that we have. And Dr. Meinig, we've discussed this, just where do we draw the line, and what teeth can be saved?
Well, actually, it's good that you brought up all of this history. It all dates back to the beginning of time. But actually, as far as the dental profession and medical profession are concerned in the public, none of this work really came to the front until, as you said, Dr. Billings got involved with the research that occurred in Europe on the subject that was called focal infection. And this is what we're dealing with. Now, unfortunately, all of this work has been criticized as being not exactly true, because what was happening during World War I days, so many teeth were being extracted, that a few dentists and a few physicians got upset about it and decided that there shouldn't be so many extractions. And so, because the focal infection was showing that actually more teeth had to be extracted because of these infections, they did everything they could to discourage physicians and dentists from learning anything about focal infections. And so this has gone on now. Billings started and announced the focal infection theory in 1904. And so we've been over 100 years now with the same kind of arguments going back and forth about whether teeth are healthy or not healthy. And the amount of research in this whole subject is so scientifically sound today that what we're trying to do, and one of the purposes of SHAC having this program today, was to let people know something about all of this background.
The question here is, and this is, I think, it's a problem that's plagued people throughout, is that even some of the I'm so appreciative of having been introduced to some of the more progressive practitioners that are around today that are spending a lot of time trying to make people aware of the hazards of root canal therapy, so-called therapy, the hazards of other practices such as the use of mercury amalgam in teeth, and yet there is a line at which people who are basically have been brought up and been educated on fixing teeth for dentition, allowing teeth to keep our teeth for dentition, that if the line is drawn and you can't do that, then they're out of business. So we have this potential financial conflict of interest that has plagued probably throughout history. This has been a problem as far as getting all the full facts out on the situation. Any observations on that, sir?
It might help the listeners to learn a little about Dr. Weston Price's research. Now, Price, from the time he graduated dental school, he spent half of his time practicing dentistry and the other half doing dental research. Within a short period of time, he became known as a dental research specialist. One of the things that he had learned from Rosenow and Billings was that these infections that come in the dentin tubules, they spread through the body and cause a person to have a variety of illnesses. Well, Dr. Price was a good dentist, and he had done a root canal for a woman patient of his, and it turned out very well. She had no problems with toothaches or pain in it. It looked perfectly fine on x-ray, and she had no symptoms with it. But this patient developed a very severe arthritis in her hands and in her ankles and in her knees, and she was so ridden with it, she was in bed most of the time, could only get around on crutches in a wheelchair. And Dr. Price said to her, there's a good chance that this is the problem with your arthritis in your hands is coming from that tooth that we treated, and even though it looks all right, we should remove it. Well, like most people, she said no to begin with, but eventually, as she kept getting worse, she said she agreed. And Dr. Price said, well, we're going to do some research to see whether this is true or not. And so she was in one morning, and he removed the tooth under aseptic conditions. He had secured a laboratory animal. In this case, it was a rabbit. And he made a small buttonhole incision in the back of the neck of the rabbit. And when he took the tooth out, he did it aseptically, so he wasn't introducing any infection to it. And he put that tooth into that buttonhole incision, and he put a couple of stitches in to keep it from falling out. And he put the animal back in its spacious cage that had plenty of good food and water and waited developments. Well, it didn't take long. In just 3 days' time, that rabbit developed the same arthritis swelling in its limbs that the patient had in her hands and her ankles and her other joint areas.
Dr. Meinig, I'm going to have to interrupt here. Let's see. We just got a couple more minutes left, but I'm very happy that that's the main point here that we wanted to raise, that you have just raised. And if I could just throw in here, that's not just arthritis, that it's a wide range of conditions here. We've got some of the ones that were mentioned by Dr. Rosenow and also by Dr. Price and Billings and so on, just to mention a few. Arthritis, even with diabetes, glaucoma, herpes, infertility, migraine, multiple sclerosis, prostate disease.
Yes, Dr. Rosenow, as a matter of fact, had listed 137 degenerative diseases that were traceable to teeth.
Yeah, so it's a much bigger problem. Did you get the results on that woman that had the arthritis, that had the tooth taken out? Did Dr. Price mention what happened with her?
Well, sure, she recovered and no longer needed a wheelchair and crutches to get around. And unfortunately the rabbit in 10 days' time passed away because of the infection that came from the tooth.
Dr. Meinig, thanks.
That Price then got into problems with heart attacks and with all of these other diseases that Rosenow pointed out in his 137 diseases.
Dr. Meinig, thanks a lot. We've got about 30 seconds left here, and I want to, I've got the camera focusing here on a saying, the tooth bone's connected to the, and so if we start with the foot bone's connected to the ankle bone, to the leg bone, and we go all the way up, and we know that there is differences here, as their tooth is harder than any other bone. Pierre Fouchard, the father of dentistry, called the tooth the hardest bone in the body, and there is some question as to some of the dentists do not want to concede that the tooth is basically a bone, but it's more similar to a bone than any other tissue, and at the minimum, it is alive, and we want to try to keep it healthy and learn how to heal it. We don't know how yet. Hopefully through the good works, your publication, Root Canal Coverup, and through other works that we can get some more facts out on this situation. If you want to reach Dr. Meinig, we have a number here for myself coming up here, an email. You can email me or call, and I'll get you the information on how to reach Dr. Meinig. And I want to thank you all for tuning in, and thank you to Adelphia Cable for having us here today.
Thank you very much for having me.
Thank you, Dr. Meinig.